It is. Good morning, Mr. Chairman, members of the committee. Thank you for the time to be heard on this very important bill. My name is Brent Walker, and I'm General Counsel for the Medical Association of Georgia. And we rise in support of Senate Bill 68 and ask for your favorable consideration of this bill. For myself, I've been a practicing attorney for about 18 years. Prior to joining MAG in private practice, I'd been a litigator on both the defense and plaintiff sides of medical liability issues in both Alabama and Georgia. Medical Association of Georgia itself has, for 175 years, been the leading advocate for patients and physicians in the state of Georgia, and has been around these issues for quite a long time and has a long institutional memory regarding them. We have about 9,000 physician members across the state in many different and varied geographic and practice specialties. And, year in and year out, when we survey our members, civil liability is the leading concern amongst physicians because it has direct impacts on the practice of medicine and the outcomes for our patients across this state on a daily basis. I think it's apparent from the testimony and the reasons these bills have been brought forward over the last year that our system of civil liability is profoundly out of balance. And nowhere is that more acutely felt than in the context of medical liability. The state of medical liability has a profound impact on access to care, costs of care, and our ability to recruit and retain physicians. This is important at a time right now where Georgia is 4,000 physicians short of meeting the national average. By 2030, we're projected to be 8,000 physicians short. Nearly 150 of our counties are federally defined health professional shortage areas. 1/3 of our practicing physicians are at or near retirement age, and every year we lose about 50% of our graduates from residency programs across the state who elect to move to other states. And one of the leading reasons of this is the medical liability climate that our physicians face. Right now in the state of Georgia, to resolve a medical liability claim just for a physician, the average cost is around $630,000. Over the last 10 years, our physicians alone have paid out over $1.5 billion to resolve medical liability claims. What we see is a direct impact on the medical liability premiums that we have to pay across the board. Since 2016, medical liability premiums have increased almost 90%. We see general specialties like OBGYN and general surgery faced with premiums for 1 million, 3 million policies in excess of $100,000, which can really be cost prohibitive for physicians looking to enter private practice and is a distinct burden on our hospitals in particular, who operate sometimes at deficits in rural areas and constantly require the assistance of our state to keep their doors open. And even with all the support that you provide, their essential services like emergency rooms and labor and delivery centers are being closed because of this issue. Fear of litigation is very real for our physicians. And it's not just the financial costs that we experience, but there's a distinct emotional and intellectual toll that's being taken on our physicians that prevents them from continuing to practice or impacts disproportionately where they elect to practice. Far more oftentimes than not, we see new physicians entering into employed practices at large institutions or with large practices centered in urban areas to the detriment of our rural areas because of the costs associated with this issue. It also results in higher costs because of the very real nature of defensive medicine that's being practiced by our physicians because of the fear. Most physicians will tell you that they're able to make a pretty sound diagnosis, and the nature of differential diagnosis is really important, that they don't typically have to order a lot of extra tests. But the fear of litigation drives them to order extra x-rays, extra blood tests, just to cover themselves in the event that they're hauled into court under an accusation of malpractice. And that cost, in many cases, is borne directly by the patients who have healthcare insurance plans with very high deductibles. In 10 years, speaking for myself, personally, my wife and I only met our out-of-pocket maximums in 2 years, and those are the years that our children were born. So it's very rare. Otherwise, we were bearing the costs of emergency room visits, blood tests, strep tests, you name it. That came out of our pocket to meet our deductible limits, and that's a very high cost in a time when the average family can't bear an unexpected $500 bill and lives paycheck to paycheck across this state. And it causes our patients to delay care. And this is a very important issue. The 5 sections that we're here discussing today are very important. They represent very reasonable changes to procedure and with seatbelts, the way evidence is presented in our courts, that work to create a civil liability system that is fair, predictable, and efficient. In no way do these reasonable reforms impact the ability of an injured party to bring a claim in court. It simply changes the rules that impact how the juries are going to hear this and how the evidence ultimately makes its way to them. And this is really important in medical liability cases because these are, regardless of the estimated value, some of the most complex cases that our courts handle on a daily basis because of the requirements for expert testimony. And when cases are really important and really complex, the rules really tend to matter even more. For instance, in Section 1 regarding anchoring, 1 minute. That's very essential because I followed a case in Cobb County recently with a catastrophic injury against an emergency room physician. And what we found was that during the course of the trial, it was suggested the value of those injuries was between $200 and $300 million, which is really devastating to the physicians in the practice of medicine. Ultimately, a defense verdict was found, but at closing arguments, they asked for about $170 million. They're anchoring these really high, and that's important in medical liability because you have catastrophically injured patients that were already sick to begin with. When we talk about voluntary dismissal, that's really important to bring us into conformity with the federal rules in our neighboring states because what we see is that's leveraged against plaintiffs to create higher settlement values. Against defendants to create higher settlement values. In medical liability, we regularly see 200 and 300 pages of complaints, along with affidavits, exhibits, and piles of discovery, interrogatories, requests for production, and requests for admission that the plaintiffs have had months to prepare and investigate, and now the defense has 30 days to respond to all of this. It creates an incredibly unfair and expensive situation from the inception of the litigation that's unfair for our physicians. On voluntary dismissals, it's also essential because, again, it's cost. The rules are being leveraged against our physicians in order to create an unfair and unjust playing field. And finally, on seatbelts, regardless of the evidentiary common sense that makes, it's an important public policy decision that we encourage our people in the state of Georgia to be safe because our physicians in the emergency rooms will tell you they're tired of seeing folks not wearing their seatbelts. Thank you, and I'm happy to entertain any questions.
Thank you. You have a couple of questions. I think Whit Park was the first one to request.
Thank you, Mr. Chairman. Based on the National Practitioner Database, paid claims are decreasing in premiums over time when adjusted for inflation and population growth are stable. Can you provide me an actual source for your claims?
That is the National Practitioner Database, and I would dispute the number that you're offering there because that is such a qualified number to meet the narrative that the numbers are about to scream. What we've seen over the years is an increase, not necessarily in the frequency of medical liability claims, but in the severity of claims. Again, 20 years ago, the average settlement value and resolution value was around $330. Today, it's $630,000, and that is a very real number for our physicians.
If you could provide me a source, that would be
I'm happy to provide that to you.
A few more questions, if I may. Is it not true that, 2 more questions, Mr. Chairman, if I may. They'll be quick. Is it not true that medical malpractice premiums have fallen by 19% from 1990 to 2024 adjusted for inflation?
That is not true.
Again, if you could provide me written
I'm happy to
source,
provide
that'd
that
be
for you,
greatly
yes.
appreciated. Lastly, is it not further true that in states that have expanded Medicaid, we have not seen their hospitals, rural hospitals, either shut down, and we've seen lower premiums for individuals in states that have actually covered their uninsured population, as opposed to these claims of medical malpractice insurance increasing?
Well, the way in which Medicaid expansion is addressed is an important factor, but the driving factor right now is medical liability claims, particularly in the state of Georgia. And while expansion of the payer mix in rural areas might incentivize physicians to enter practice there, it's not a good incentive to reduce medical liability premiums or anything like that. The hospital closures are very directly related, particularly in surgery, emergency medicine, and obstetrics and gynecology, to the high costs of the malpractice premiums that they have to pay to support this. And really, in order to meet the standards of care, the numbers of physicians that they have to employ that they simply can't afford to do. Happy to take any other questions.
Thank you. Well, we've got, I got Al Williams at the end here. I think you had a question for you.
Thank you, Mr. Chairman. Thank you, sir, for your testimony. You said some very interesting things. I have a question. My question is, let me predate with this. I've spent the last 3-4 years traveling this state, working on problems through the Rural Development Council, where we looked at rural hospitals, physicians. And I must admit that in all the testimony, I never heard, and we heard so many problems that are closing our hospitals and why physicians are not coming. I've heard from deans of medical schools as well as physicians, and never once have I heard that we can't get physicians because of premiums.
Well, that's very interesting, and I have a completely different set of data. And in the Governor's Roundtable last summer, that point was made abundantly clear by our physicians and hospitals in that effort. But the amount of premiums that are being paid as an associated cost with the entry to practice of medicine are very profound, especially for private practice physicians who are the most likely to practice in rural areas and provide additional care. And that's something that I see day in and day out with the physicians who are members of MAG. This is a massive issue, particularly for our core specialties that are higher risk, like general surgery and OBGYNs. A typical OBGYN can pay $120,000 for a $1 million, $3 million policy with no excess coverage. That's a tremendous line item if you're trying to start a practice. Not to mention the amount of equipment that you need in the clinical settings that only a hospital or institution can provide to be efficient and meet the standard of care for labor and delivery. So they are constantly being deprived of their ability to access rural areas and establish their practices.
Thank you. Speaking of doctors, Chairman Newton.
Thank you, Mr. Chairman. I appreciate your work on behalf of patients and those who care for them. I've had some conversations with fellow members of our subcommittee regarding auto insurance rates, and one of the questions, so when we bring up malpractice rates, one of the questions is, are the insurance companies just getting rich on this, or is there something else going on? My understanding from my auto insurance friends is that many auto insurers and truck insurers have actually left the state. I would contend nobody leaves the state because they're making too much money. They don't drop their policies. Have you seen in hospitals or medical malpractice carriers any of them leaving the state?
Yes, we have. We're starting to see very distinct trends within the medical liability insurance markets. About 80% of it is covered by 4 very large insurers, and several of them have stopped writing new policies in certain areas of the state, leading to a contraction in the availability. Down on a downward look of the scale, a lot of hospitals and physicians groups have captive insurers to reinsure the frontline policies of the physicians. And a lot of those are either ceasing operations in the state or they're stopping the issuance of new policies because of the prohibitive costs generated by the civil liability system in the state of Georgia. And we know that these reforms are incredibly effective because I can tell you in the context of medical liability, the last time we did a major reform in Georgia in 2005, by 2007, medical liability insurers had reduced premiums by 10 to 18% across the board, which is a significant savings for our physicians and the patients that benefit from the lowered costs of that. So there is a profound impact that can be had by these very reasonable reforms to the way our courts handle liability cases.
Thank you, sir. You're absolutely right. I was going to mention with Whip Park, when he mentioned that 1990 till now, there was a decrease. I was running an emergency department group back in 05, 06, 07, that time frame and we did see, we were able to hire an additional physician to take care of patients with the savings on malpractice liability at that time. And it was a good effort. It's 20 years later now, so look forward to moving forward.
Thank you.
Thank you. I believe Representative Evans, you had a question?
Yes, thank you, Mr. Chairman. Thank you, Mr. Walker. I wanted to talk about the recruitment of doctors. And I appreciate the concern for having doctors, particularly in rural areas. And I'm originally, while I represent Atlanta now, I'm originally from a rural part of the state, and I couldn't agree more that that's important. But wouldn't you agree with me that recruiting doctors to rural areas, it's not just a problem in Georgia, that's a national issue?
It is a national issue, but it is particularly acute in the state of Georgia.
But in Georgia, even with the difficulties that we sometimes have recruiting, not just doctors, but other professionals sometimes to rural areas, Georgia's actually seen an increase in physicians moving to rural areas over the last 20 years, and those numbers have been stable for us in Georgia, thank goodness, probably because of the work done in this body with the Rural Development Commission. We've been stable in our numbers at least since 2000, if not increasing. Would you agree with me on that?
Well, I would
And
disagree
if
that
not,
we've
could
been
you provide me the
increasing.
data and tell me
Yes,
why the
I'm
efforts that
happy
we've
to do
taken
it.
are not working here?
As a general proposition, we have seen over time an increase in the number of physicians. I believe that
We
the
have
Healthcare
seen.
Workforce Board is tracking about 27,000 resident physicians. That's up from about 25,000 the last time they did their biannual survey. Unfortunately, we are still tragically short of the needs of our growing population. I mean, we'll add another 1 million people in the next 5 years that require, additional care from physicians and nurses and our nurse practitioners and physicians assistants. And it's really essential. We haven't kept pace in the ability to deliver the appropriate levels of care. And again, I would point that despite the hard work that we've done, and it's something that should be applauded, and we have to continue doing that, but we still have the vast majority of the state of Georgia that is a health professional shortage area.
But numbers
and
still
that
going up.
impacts,
Numbers going up or down?
the numbers have stayed relatively stable, but I expect that they're going to continue to decrease relative to the national averages, and Georgia is going to remain in the bottom 40 when it comes to physicians. per
Final question for
100,000.
me. Recruiting doctors, whether it's rural areas or just to the state generally, there's a lot that goes into that. It could be quality of life. It could be availability of real estate. When we got private equity buying up all of our homes, it could be any number of things, including specifically for OBGYNs. Certainly you can't exclude as an issue that we have statutes on the books in this state that criminalize OBGYNs for providing life-saving care to women. Isn't that true?
I have heard the statement made, and I'm willing to accept that that has an impact on our ability to recruit. However, most of the evidence right now is still anecdotal. The statute that you're referring to was passed in 2019 and took effect in 2022. The numbers that we have from before 2020 already demonstrated an impressive and alarming decline in the number of practicing obstetricians in labor and delivery across the state.
And
By
we also
2020,
had
we had
the
a shortage
20-week
of
bill,
80
we had the
counties.
6-week bill. We had a lot of restrictions around the care of women and the extra scrutiny on pregnancies and how abortions might be dealt with before the heartbeat bill. You would agree with me on that, I think.
There was a lot around it, but more recently, it's hard to determine what the impacts of that legislation are right now until we get updated numbers on our healthcare workforce, which I don't anticipate we'll see those until later this year or early
Later this
next
year.
year.
Thank you.
Thank you.
All right, thank you. I think Representative Miller, you have one quick question, rapier-like, I think.
Thank you, Mr. Chairman. My question is this. During the period of COVID-19, there was a virtual shutdown of our judicial system. You would agree with that, correct?
Yes.
And yet, medical malpractice premiums continued to rise, even though there weren't any verdicts happening for years, correct?
Correct, but there were still settlements of these claims that were happening in the background.
I understand, but so then if there was a obvious decrease, right, naturally, logically speaking, can you explain to me why the insurance industry continued to raise premiums on your doctors?
Because while the pandemic...
If there's a correlation between the two.
While the pandemic did effectively shut down our courts for a period of time and toll cases, we've seen a significant uptake in medical liability cases after the tolling of the pandemic. If anything, what the data from the MPD shows is that was something of a plateau in claims. But just because the courts were closed didn't mean that demands weren't being sent and claims weren't being made outside of the filing of complaints. And during the pendency of cases while the courts were closed, I mean, there was still a cost associated with that they barely had time to keep up with. So there was a distinct impact. It was a bit of a silver lining that there was a decrease in the number of verdicts, honestly, on a terrible time in the history of this country. But we've seen it catch up in the numbers lately with the rise in the average settlement values and the numbers of verdicts that are coming out, and we're still distilling what the full impact of that is.
All right, thank you. Thank you very
Thank you,
much
sir.
for your
Thank you.
testimony. Appreciate it. Thank you, Representative Miller. Let's see, we have Dennis Keene.